the maneuver closes that space under the acromion.
That would be like 10 feet.
It could be, but it's sharp, it's acute, and it comes from the maneuver itself. So that's Hawkins, that's impingement. Another way you can test is forward flexion. This one is done in supine, so we're going to assume it's lie down. Two things here. What we're trying to do again is close this space through manipulation. So two things happen. In the humerus, the position is going to be internal rotation with forward flexion. So one hand is guiding the humerus into forward flexion and internal rotation. The other hand is depressing the scapula. Right? So one hand is managing the humerus, internal rotation and forward flexion, and the other hand is pushing the scapula down. What both of those maneuvers do is to try to close off that already compact space. Okay? Scapular depression with one hand, and then forcing the humerus into flexion and internal rotation with the other. They're both impingement tests. Okay? Most often, if one is positive, the other is positive, but there might be a time when there's a dissociation. So if you're thinking impingement, you want to do both. Okay? Stimulated, sorry. The next one on your test is pec length. It's typical for people that have shoulder pathology to develop tightness in their pecs because of their carrying position, their alignment, or some people just have shortened pecs by genetics or through their activities, and it causes problems. So what we're looking for is symmetry in terms of the length of the pecs. So this is observation and palpation. Your patient is lying down, okay? And I'm looking at the height from the acromion to the table, or the shoulders to the table. And with Sue, I can, she's slightly forward, which is normal, and I can slide partially my hand underneath her scapula. If she had a pec length discrepancy, one scapula would be further off the plinth, right? Pec tightness pulls you forward. So what happens is on this side, I can slide my whole hand underneath her scapula because it's not resting on the plinth, and the other hand I'm only getting up to like halfway through my fingertips. So I can do that through palpation, and I can just come down here and again do my height related to my acromion and see the difference as well. Does that make sense? So usually we're looking, some people will just have rounded shoulders, but this one we're looking for a difference. Now if her scapula is higher, the other thing I can do is just ask her to just relax, relax, relax. Because it might not be that the tendon is short, it might be she's just guarding for pain, doesn't even realize it. So ask them to try to get voluntary relaxation. If it doesn't relax, it's shortening of the pec. Okay? Yeah?
So with this, if they don't have full shoulder range of motion, you're looking to see if it's because the pec valve is short. Is that kind of, I guess I understand when you do this test.
When you do the test,
Yeah.
we want free-flowing tendons. We want full excursion in tendons. If somebody has shortening in one side, their scapula is going to be up off the plinth. So that means when they start to lose, their scapula is already out of alignment. So we're going to start to lose that glenohumeral rhythm, scapulohumeral rhythm already because the scapula is out of a resting alignment. We need to figure out why it is. One potential reason is the pecs are shortening, pulling the scapula out of alignment, and it's a typical malalignment. Okay? So that's heckling. That's pretty straightforward. Now we're going to sit up. The bicep speed test we also did, so to remind you, the position is 90 degrees at the shoulder, supination, and it's resistive with a long lever arm, so don't let me move you, okay? This is specifically testing for the integrity of the biceps tendon. So similar discussion from before. So if she has inflammation of the biceps tendon when I push, she's going to have a pain response or pull away from me. Or she might just break as soon as I put the weight of my hand on her if there's a rupture. Okay? So bicep speed test. So on some level, they're kind of like long levers.